Health now, where the Coordinating Minister of Health and Social Welfare, Professor Pate, says the successful regulation of service quality and the free VVF repair program in rural areas across the country has benefited more than 1,000 women with fistulas, saying further that achieving universal health coverage requires sustainable financing and resource allocation. Acknowledging that Nigeria's $15 per capita public health investment is insufficient and places a heavy financial burden on households. The coordinating minister says guaranteed access to quality care requires increased government spending on infrastructure, diagnostics, healthcare workers and logistics. The coordinating minister made this known at a press briefing marking the Universal Health Coverage Day at the ministry's headquarters in Abuja on Thursday.
As we celebrate this day, knowing fully well that it's on the government, but with the support of the House and everyone else, that we will get to the cruising altitude and Nigeria will be on its path to universal health coverage. We outlined in the last year and a half under the leadership of this president an ambitious agenda which acknowledged the challenges that Nigeria had in terms of financing of its health. Universal health coverage is not free. It's not cheap. Good quality health is not cheap. It has to be invested upon. And health is an investment. For every dollar that we invest in health, there is a multiple dividend in economic development. We also acknowledge the structural limitations, the fragmentation, the efficiencies, but we collectively made the decision to come together, federal government, state governments, all the 36 state governors, local governments, our development partners, and agreed on a compact that we will reorient our system to achieve better health for all Nigerians, to save lives, reduce physical and financial pain, produce health, and to do it for all Nigerians. As we have started to take off, we're beginning to see signs that, in fact, there are tangible progress. So in the last 1 year, from the time we signed the compact and now, what NHI is saying is that we've added 2 million Nigerians on health insurance. There's 700,000 using the VGF. Now, this is just in 1 year. Now, if Nigeria had been adding 2 million for the last 20 years, we would be at 40 million today. So the pace at which we are now adding is actually dramatically shifted. And that is financial protection.